Hi, so my presentation is about the cochlear implant and the deaf community. So the outline is the first we're going to talk about the explanation and history, and then the medical risks and needs, controversy among the deaf community. I'll show you guys some anecdotes. I have some Q&As, and then my works cited. So first, what is it? The function of a cochlear implant stimulates auditory nerve neurons directly with electrical stimulation, bypassing the damaged or absent sensory hair cells in the cochlea. So usually cochlear implants are given to patients or recommended to patients when they already tried hearing aids and it didn't work for them because they couldn't understand speech or spoken language. And it's basically there's an outer part and an inner part. The microphone is trying to capture sounds, and after processing the sounds, it sends pulses into little wires that connect to the parts on the inside. And the sound data is processed and creates a hearing sensation. Hearing is not restored, but it is improved and can lead to better communication through lip reading, and listening is heightened and awareness of surroundings. So basically, the history started in the 1800s. Volta attached a probe to each pole of a battery and placed one in his ear canal and linked to another one, and he could create a switch to control the current flow. And then in 1855, they used an alternating current and reported a buzzing, hissing, and ringing sound, which was better than what was before. In 1930, Weaver and Bray recorded cochlear electrical potentials that closely matched the sound of a sound wave or a stimulus waveform. In 1957, a solitary electrode has been placed in the cochlear nerve instead of the canal, and the patient could hear sounds with the aid of the implant but not interpret speech. In 1961, House made a custom-designed cochlear implant device, but because of difficult challenges, they had to remove it. In the 1970s, they introduced a better working cochlear implant, and pediatric implantation was introduced. In 1984, the first FDA approval for a cochlear implant for deaf patients 18 and up was introduced. And in 1984, the Cochlear Corporation released the first multi-channel cochlear implant called the Nucleus 22. So the medical risks and needs, as hearing loss progresses, there's less room for habilitation. So usually, people are just, doctors are told to parents of deaf children, if they want a cochlear implant, then they should do it, the sooner the better. The external components of the cochlear implant will be inserted 4 to 6 weeks following the operation, for healing to get going. Some of the risks are bleeding, swelling, infection, ringing in the ears, dizziness, numbness, change in taste, dry mouth, injury to facial nerves, and leakage of spinal fluid. And those are just some. So the controversy in the deaf community, the arguments for, is that a child's general health and wellness are improved when they're able to hear noises and things that are surrounding them for safety reasons, like if they're playing outside in a front yard or backyard, they can hear noises that maybe can be contributed to their safety. And also the overall advantages of the implant for speech and language are less effective later in life so in order to have the greatest results, you have to do it when you're a child. And that's a rebuttal to one of the arguments against the cochlear implants. So for the arguments against, one of them is that parents who decide to implant their children are frequently misinformed about the operation, and also the dangers, the cons, disadvantages, and the long-term obligations for rehabilitation. It's also if some people cease to identify as being deaf, and so a lot of people in the deaf community are scared that deaf culture might diminish if this keeps on happening. Um, Also, it violates, or some people think that it violates bodily autonomy of a child because the parents decide for them ultimately. And then also, um, some people think that it becomes hard for children to associate themselves with both hearing or deaf groups and culture. So, for an anecdote, here Amari's story. So she was born with significant hearing loss, and speech therapy and hearing aids were used, but the hearing aids did not work, and she also did not like wearing them. So doctors and audiologists suggested that she could maybe do cochlear implants, and so they proceeded to do that. And in October of 2016, her implants were turned on a month after surgery, which is very well because she had an excellent recovery. Her verbal abilities have greatly improved since then, and today she is almost caught up to her peers in terms of language proficiency. But then on the other side of things, a 12-year-old boy in India with a cochlear implant, there was a case study on um, little boys in India with cochlear implants, and they saw that um, some children, or there's a deaf child that was given a cochlear implant at the age of 5 and it broke by the time he was 12. And so he was unable to either have spoken or sign language because he did not learn it. The boy's difficulties served as a reminder that it's important to have a great patient education about technology and the reality that living with a disability is not only doable but also normal and typical and something you can do. So for the Q&As, what is the earliest a child can get a cochlear implant? Is 12 months to 9 months typically. What is the latest age that you can get? So as of right now, there's no age limit, even though doctors say that the earlier the better. How much does a cochlear implant usually cost? It usually costs 30,000 to 50,000, so a range between there. And there's my works cited. And that's my presentation. Thank you.